The glide and slide is not just all fun and games for a child. Neither the shepherding and seemingly unending chase for pasture. The running around that we ignore or take for granted could be the only one thing that prevents your child from a premature death or disability in adulthood. The World Health Organization recommends about 60 minutes of moderate to vigorous physical activity daily for children and youth aged between 5 and 17 years. But this is hardly the case in Kenya, which is fast urbanizing and therefore becoming increasingly sedentary. As a result, only about 50% of children in Kenya are physically active.
That need attention.
This is according to a new study by researchers led by Vincent Onyuera of the Department of Exercise Science at Kenyatta University. Because of the modern but unhealthy lifestyles of urban children, 1 in every 2 you meet on the streets or in school is at a high risk of obesity due to inactivity compared to their peers in rural areas. Herding is a designated duty for young boys and girls in various families in the rural areas, hence keeping them fit as they walk kilometers to take the livestock to get feed and water.
The kids in the urban areas, some of them were spending over 10 hours on screen on weekends, sitting behind the screen. And the definition of screen here does not necessarily mean the television, but we mean television, PlayStation, mobile phone, any computer, laptop, any digital device.
The findings also shows that 87% of children in rural areas use active transport while going to and from school. The term active transport in this case referring to either walking or running. This daily way of getting to and from school, which is viewed by the urbanites as an excruciating grind, actually makes the rural children fitter than their urban counterparts. As less than half of urban children use active transport, the rest prefer motorized ways of getting to school. The World Health Organization has warned that physical inactivity is the fourth leading cause of death as a result of non-communicable diseases in the world.
Non-communicable diseases are on the increase, and by the year 2020, non-communicable diseases shall have surpassed communicable diseases. Talking about hypertension, forms of cancer, diabetes, heart disease. And we know that all these 4 NCDs have 4 shared modifiable risk factors: tobacco use, harmful consumption of alcohol, unhealthy diet, and sedentary behavior or lack of physical activity.
The Global Health Body states that childhood obesity is associated with a higher chance of adult obesity, premature death, and disability in adulthood. In addition, obese children experience breathing difficulties, increased risk of fractures, hypertension, and likelihood of cardiovascular disease, insulin resistance, and psychological effects. Eunice Omollo, NTV for the Health Assignment.